Hey, we're here at NASS 2023 in LA, October. I'm here with Sriram, Sankar with Diffusion Technologies. They have a product called Zfuze that's pretty interesting, but I'd like to hear more about it. If you could tell me a little bit about the technology.
Thanks, Nick. Zfuze, like Nick was mentioning, is actually a new biomaterial that's actually used in the spine and orthopedic space. So, if you guys are aware, I'm sure in the orthopedic world, there is the polyether ether ketone, or PEEK as they call it. That's the plastic that's used to make spine devices, or you have titanium. And both these materials have disadvantages intrinsic to them. PEEK has the same modulus as bone, but is not very bone friendly, and it doesn't have the kind of bone-friendly properties of titanium. Titanium, on the other hand, is very bone-friendly, but is much more stiffer than cortical bone, and is also not radiolucent, so it has these imaging negatives. So how do you marry the two? Have the perfect modulus as bone, have great bone response characteristics, as well as have the perfect imaging properties. And lo and behold, we have introduced this new biomaterial called Zfuze, which marries all of it. And importantly, Zfuze is also the first kind of synthetic material that actually gets the bone or the immune response to feel that the material is like the self. In other words, it doesn't have an host immune response that is negative. All implantable synthetic materials have that sort of response, and we've engineered this material to not have that response. Right now, this first product called Zfuze is being sold for lumbar fusion as well as for cervical fusion. So if anyone's interested, feel free to reach out to us at www.DiFUSIONTech. That's diffusion with a single F, TECH.com. And the advantage to the patient is pretty neat in the sense that the recovery timelines are much quicker. For a typical lumbar surgery, it takes about 10 months to a year for the patient to heal. With this new material that's made into interbody cages, we're seeing healing happen about 7 to 8 months. The patient recovering fully, and we've seen this in a clinical trial that also includes osteopenic patients and patients with comorbidities. So people with other cofactors that could actually debilitate healing actually are able to heal much quicker with this material in the form of interbody cage.
So this sort of lattice that it's built from, I noticed that you can infuse some other properties and chemicals to help support bone growth, and I was wondering about if that's something that's done through your company, or if it's something that you just offer as an option.
No, so this is the first generation of this device is without cations like calcium, magnesium, zinc. All of these mineral metals actually help with bone growth, but we don't have the ability for a material platform that can deliver these sort of ions at very low parts per billion, arranged to elicit this sort of therapeutic response. But this is the first material that can do that, and so the next generations of this material is going to allow for this sort of release of these therapeutic metal ions.
So that's what's next.
That's what's next. That's what's in the pipeline.
Okay.
Correct.
Can you tell me a little bit about the company? Like, how long has it been?
Yeah. So we were founded in 2009, and we've been developing this technology over the last 7-8 years, and then we have a whole processing as well as production facility in Austin, Texas. And also we have been working on developing this for the spine market, and also looking to get into the craniomaxillofacial trauma and dental spaces along with the hip and knee markets. So
is the product manufactured as a material to use for manufacturing, and then manufacture their own designs, or is that something that you get designs and then?
No, at the moment we are an end device manufacturer. So we take the material and we basically fabricate it into an end device, which is the spinal interbody fusion cage. But down the line, for folks who may be interested in taking this material and using it for other applications, we'd be open to sitting down with prospective partners and kind of figuring how to use this material in different adjacent segments.
How long have you been working?
I've been working with the company from 2012, so I've been with them for a
geez.
good 10, 11 years, and I've grown with the company, and I've worked primarily on developing this technology.
You think you could give me the story of basically the genesis of it?
Yeah, so the genesis of the company was, our founder, who's Derek Johns, who's basically, a professional in the orthopedic world. He's worked at different, med tech device manufacturers like Abbott and so on. So when he got out of Abbott back in 2008, he had this colleague of his who he had worked with previously, reach out to him and say, hey, I had this molecule called zeolite. It's like an FM radio. It basically can tune any sort of metal cation and release it in low parts per billion. Do you have any use for it? And then Derek, who's the CEO, is like, Joe is the other co-founder who worked on zeolites. So he said, Joe, I have no idea what you're talking about. I have never seen or heard zeolite in the orthopedic world, so I have no clue what you're talking about. Lo and behold, that's when Derek was looking into the old orthopedic and trauma space. He found that especially with dirty wounds or in terms of any sort of shrapnel or even battlefield injuries, he found that the infection rates were pretty high. Actually, he said 14, 15, 20%. And he was like, oh wow. And at that point, silver, as we know, is pretty antimicrobial, but the point is, how do you deliver a silver or different cations at very low parts per billion ranges and control the release rates? Because all of ththese metal ions have biphasic effect. What do you mean by that? They can initiate cellular processes or inhibit. So you should have the ability to tune the delivery of these cations at the right window for the right duration.
Okay.
And that's when he remembered what Joe had told about the FM radio, tuning delivery device. And he called Joe back and said, hey, do you think we can try this out in the whole orthopedic space? And he was like, heck yeah, let's try it. And that's how they began wanting to incorporate these sort of metal ions into zeolite in peak. And so that's basically how I came into the fray. And because that was kind of my thesis in grad school, and that's how we began developing this whole technology.
Well, I appreciate the time.
Thanks so much, Nick. Yeah,
it was great to meet you. Absolutely. And we'll be talking to you again soon.
Sure. Thanks so much.